my name is Rebecca. I'm just going to be doing an assessment on you. Starting at the head, going down to the neck area. I'm going to inspect your eyes, nose, mouth, and ears. Okay.
Okay.
So I'm going to start by inspecting the scalp. Just going to kind of be looking for any lesions, any dandruff. Hair is dark brown, gray is mixed in. It's a thinner texture. The hair on the eyebrows is thicker, and then the fine villous hair coats the rest of the body. I'm gonna go ahead and palpate. Just gonna kind of push. Do you feel any tenderness?
No, ma'am.
Okay. And the normal points of protrusion would be the temporal, the occipital, and the mastoid process behind the ear. Okay. All right, so the head is normocephalic, which is proportional to the rest of the body. The next thing I'm going to check is the eyebrows are symmetrical. The palpebral fissures, which are the opening of the eyes, are symmetrical, and then the nasolabial folds, which are here, are symmetrical as well. There's no exophthalmos, which would be bulging at the eyes. There's no offset of skin pigmentation. There are a few freckles here and there, but that is normal. There's also no swelling. There's no facial tics noted. Okay. So the next thing I'm going to check is called cranial nerve 7, which is called the facial nerve. So I'm just going to ask you to do a few things. I'm just going to be looking at the symmetry of it. So smile for me. Okay, show your teeth for me. Frown for me. Lift your eyebrows up for me. Okay, and puff your cheeks with air for me. And I'm just going to kind of push. Okay, and air escapes equally on both sides. Next, I'm going to check cranial nerve 5, which is called the trigeminal nerve. So what I'm going to do is I'm going to start by palpating the temporal. Okay, and then the temporomandibular joint is here. So go ahead and open and close your jaw for me. Okay, and that was moved freely with no restrictions. Okay, go ahead and clench down for me. Okay, and I can feel it tightening in both areas. Stay clenched down. I'm going to try and separate the jaw, and I can't, so that's good. Okay, next thing I'm going to do is I'm going to feel the sinuses. So you should feel a little bit of pressure, but no pain. Okay, here are the maxillary sinuses, and here are the frontal sinuses. Any pain? Okay. All right. So the next thing I'm going to be assessing is the eye. So I'm going to start by assessing cranial nerve 2, which is a visual acuity test. So I'm just going to get you to read this sheet for me.
AEFG 32140.
Okay, good. Next thing I'm going to be assessing is cranial nerve 3, which is called the cranial nerve 2 is the motor nerve. This cranial nerve 3 is the oculomotor nerve. So what I'm going to do is I'm going to get you to look straight for me. I'm going to just be checking to see if the pupils are dilating. I'm going to check this side. Okay. Pupils are equal, round, and reactive to light. For accommodation, I'm going to get you to kind of look far away for me. Look here. Okay, good. The next thing I'm going to check is cranial nerve 4, which is called the trochlear nerve. So what I'm going to do is I'm going to start with my thumb here, and if you can look at my thumb and follow it down the nose. Good, okay. Next, I'm going to check cranial nerve 6. Cranial nerve 6 we're going to test the 6 cardinal gazes, which is called the abductens nerve. So I just need you to follow this pin for me. Okay, good. All right, so next I'm going to check the external structure. So I'm going to start by checking the lacrimal apparatus. So I'm just going to lift up and look underneath. Okay, it appears pink, appears normal. The next thing I'm going to check is going to push on the nasolacrimal duct. Do you feel any type of pressure more than just what I'm pushing on? Mm-mm. Okay. Next I'm going to check the cornea of the eye. So I'm just going to shine this light. It should appear clear with no cloudiness, and it does. Next, I'm going to check the iris. The irises are flat. They're evenly colored all the way around. And the sclera is china white. There's no redness. There's no like yellow bumps or anything like that. Fatty deposits. That's good. The next thing I'm going to check is the conjunctiva. So just going to push down. It appears pink, it appears moist, that's good. Eyelashes are evenly distributed over the eye. Let's see, eyeballs are in the socket. They are not protruding or sunken in the socket. They look normal. And the eyelid closes over the conjunctiva, which is normal. Okay, so the next thing I'm going to be assessing is the ears. So I'm going to start by kind of pulling the peanut up, okay? And the opening noted size is small, which is what it should be. There's no drainage, there's no irritation, no redness. Okay, I'm going to kind of feel on both the ears. Do you feel any type of pain? Okay, all right, so no pain. Okay, so I'm going to be checking cranial nerve 8, which is called the acoustic nerve. So what I'm going to do is I'm going to occlude one side, and I'm going to whisper in here, and I'm going to get you to tell me, and then I'm going to do the other side, okay?
I like food.
Okay, and I'm going to check this side.
Blue is my favorite color.
Okay, good. Also going to note that there's no type of any indentions. The skin is good. The skin is intact on the ears. Alrighty, so the next thing I'm going to be checking is the nose. So the nose is symmetrical with the rest of the body. There's no redness on the nose. I'm going to kind of feel, is there any tenderness? Okay, so I'm going to go ahead. I'm going to occlude one nostril and go ahead and breathe in for me. Okay, I'm checking the patency. Okay, so it does sound a little bit stuffy. I'm going to go ahead and get you to lean your head back for me. I'm just going to be checking the nasal, the nares. Everything appears pink and moist. Nasal mucosa. Okay, and I'm going to check the septum. So it does appear that she has a deviated septum. One side is a little bit more occluded than the other. Okay, and the next thing I'm going to do is I'm going to be checking cranial nerve 1, which is called the olfactory. So I'm going to go ahead and get you to close your eyes. I'm going to get you to smell and to see what, just tell me what you smell.
Smells like minty toothpaste.
Okay, good. All right. Okay, so the next thing I'm going to be doing is I'm going to go ahead and check your mouth area, okay? So first I'm going to examine the lips. The lips appear pink. There's no lesions, there's no tearing or bleeding on the lips. Okay, and I'm going to go ahead and pull down. I'm going to inspect your gums. Gums appear good and clear of any type of gingivitis. There's no bleeding on the gums. Everything looks good. Go ahead and show me your teeth. Okay, teeth appear to be clean and free of any type of decay or debris. There are a few teeth that are a little bit crooked there. Other than that, normal. Next thing I'm going to do is I'm going to check the inner cheek, which is called the buccal mucosa. Just going to kind of shine a light in here. Everything appears pink and normal. Okay, good. I'm going to go ahead and stick your tongue out. Just going to examine the tongue and lift your tongue up. Okay, and I'm just going to go ahead and put your tongue back down. I'm just going to kind of move it and inspect it in the back. Okay, everything appears normal. It's pink on the tongue. There's no exudate or anything like that. So the next thing I'm going to be checking is going to check the hard and soft palate. So go ahead and open up for me. Okay, and everything appears normal. I'm also going to check the tonsils. Say ah.
Ah.
Okay, and tonsils appear intact. There's no exudate on the tonsils either. So the next thing I'm going to be checking is cranial nerve 7. Cranial nerve 7 is called the hypoglossal nerve. So the way we're going to do that is I'm going to get you to move your tongue back and forth for me. Say light, tight, dynamite.
Light, tight, dynamite.
Okay. Everything's normal there. The next thing I'm going to check is cranial nerve 10, which is the glossopharyngeal nerve. So by doing that, I'm going to get you to say ah.
Ah.
Say it again.
Ah.
Okay, so the hard and soft palate do move the way that they're supposed to. Last nerve is cranial nerve 10. That is the vagus nerve. That's the gag reflex, but we won't be assessing that today. Okay, so the next thing I'm going to do is I'm going to go ahead and inspect the neck. So I'm going to start by, we're going to do your lymph nodes. So I'm just going to slowly palpate the lymph nodes. Let me know if you feel any tenderness, any pain. Also, if the lymph nodes do feel hard, they should feel soft, non-palpable, and movable. But if they do feel hard, we usually check the source of that. It could be an emergency or an emergent case, and we would find where those lymph nodes are draining and then go from there. So I'm going to start by assessing the preauricular, okay, the posterior auricular, occipital, submental, submandibular, jugogastric, The next one is the superficial cervical. And go ahead and turn your neck for me. Here's the deep cervical chain. Okay, you can turn your head back. Then the posterior cervical. And I'm gonna get you kind of hunch your shoulders forward for me. Here is the supraclavicular. Okay, all right. Next thing I'm gonna do is check the trachea. So go ahead and position your head, kind of put it down. Just kind of keep your neck muscles tight. So what I'm gonna do is I'm just gonna slip it off on each side, the notch, and that feels normal. Next, I'm gonna palpate the thyroid gland. Okay. I don't feel any type of enlargement or anything like that. Everything feels normal with the thyroid gland. The neck is free of any lesions. Did you feel any tenderness when I was palpating any of the lymph nodes?
No, ma'am.
Okay. Alrighty. And that's all for the assessment. You have a good day.
Thank you.